Acute and chronic injuries are probably the main things that are going to come in with SoftWave. I would say that the chronic injuries are the ones that are going to be nagging people. Acute, more so early onset, jumping on top of that. Chronic injuries, what we see in the office is the results are amazing. Mm-hmm. I mean, you're getting people that haven't been able to walk, jog, go from sitting to standing with their knees, and that goes down to that tissue being stagnant. Once you put the sound waves through that area and you treat the focused area with the sound wave, produce life into that joint, mm-hmm. that joint has nothing, what it's going to do is it's going to naturally start to heal. Mm-hmm. And so both we see in the office, a fair amount of acute and chronic. I mean, in the cases of just looking at case studies at Movement Chiropractic, acute injuries respond amazing. Mm-hmm. And then chronic, you might get into a little bit longer of a healing process. Maybe you're seeing the first couple visits knocking the rust off that joint. Maybe you're a little sore, but that third, fourth treatment, you're starting to see big turns. Where acute, you're going to see things change maybe 1 or 2 visits in.
Yeah, I would say one of the big things that we tell people when they first start the Soundwave is that it depends on if you come in as an acute patient, meaning within 2 weeks appropriately. Mm-hmm. Of having an injury, or chronic being longer than 6 weeks. Most of the chronic injuries that we've seen here at Movement have been years, right? So depending on if you're chronic, usually you are going to feel a bit more sore, right? 2 or 3 days afterwards, because you're getting a new blood flow. Acute's going to feel a little bit better initially, just mm-hmm. because you're going to get there's not as much damage have been done chronically long term. So blood flow is going to be easier to get into that space in a quicker period of time. So, but as far as pain-wise, getting out of that, the Soundwave, it helps to initiate, like you said, the innate healing of the body. And once the healing takes place, we do expect patients to be pain-free, or like very, very high percentage to be reduced in pain.
Yeah.
So,
and with Soundwave, there's research floating out there that one treatment has the systemic effect of 6 to 8 weeks of your body creating that turnaround of new tissue, of new cells, of new blood, of capillary dilation. Mm-hmm. And so even some of those people that leave after 1 or 2 visits and they express to us what a miracle that was, we still know that healing takes time.
Yep.
And so just a lot of encouragement around, we're thankful and we're grateful to see people respond so fast, but also understanding that it takes time to heal with the body.
And if they've been dysfunctional for an extended period of time, right, we often see, dysfunction eventually leads to symptoms such as pain. And so if you can restore function to the tissue via the SoftWave therapy, you automatically mitigate pain.
Yeah, that's good.